Hey, everybody. Welcome to In the Know with Nina. I'm your host, Dr. Nina Crowley. I'm the Director for Clinical Education and Partnerships at SICA, where we partner with healthcare professionals and clinicians to offer body composition solutions. Today, I'm joined by Dr. Jon Bruce of Bruce Wellness and Aesthetics. It's in Cary, North Carolina, near Raleigh. He's in private practice, and he has a really large weight loss, surgical, medical. He's doing all sorts of interesting things. I'm going to let him tell us about that. He's been a very happy body composition analyzer customer of ours for over a year. And I know when we first started talking, we were really, we were going to narrow down how long it took you to make your money back on the device. And I think that's a question I get a lot when people are trying to decide if they're going to jump in. So I'm going to let you kind of share what you're doing and how you've been enjoying the device, because I think it's super valuable to our customers.
Yeah, well, thanks, Nina. First, thanks for having me on the show. I am passionate about weight loss. I myself take medical weight loss medications. I've worked out, done all that stuff, lived my life, always being on the heavier side, even though I played sports and everything like that. Always a person who could build muscle, but also could build fat pretty easily. So, anyhow, I do surgical and medical weight loss, as you all know. And we got in contact last year about placing one of your body comp analyzers in my office. And I thought, maybe, okay, let's take a look at it. So, and I will tell you what, it's been a godsend. It's been a practice differentiator. And I'll kind of explain what that is. And then I did say, based on seeing it, and after having one done, I realized that I'm probably going to make my money back on this in 1 year. And I think we've made it back even before 1 year. So anyhow, where do you want to go with this next? You want to know how we got the money back, or do you want to talk about the role of it in the practice?
I think one of the things you said before we jumped on here was talking about how it really is a strong piece of your algorithm. You said it better than that, but I really liked that, kind of part of your practice that you find to be critical, and really how your patients are enjoying it, especially now that you've expanded some of your services and are kind of a one-stop shop for all of their needs. This has kind of become a big part of that.
Yeah. So the first word after my name, I put my name on the wall because everything that happens in the office falls on my shoulders. So I strive to give 110% to our patients. And I tell my staff every day, bring your A game or stay home. And they all do. And they're all friendly. And we do a very good job. But the first word after my name is Bruce Wellness. Okay. So that's what we're about. We're not necessarily about weight loss. In fact, I'd argue that we should reframe that whole discussion and call it fat loss, because what we don't want to do is we don't want to lose lean body mass. We don't want to lose muscle. And muscle is loss of muscle is a good indication of loss of lean body mass. Okay. And, if you're using a regular scale that doesn't differentiate between lean body mass and fat mass, then you really can't tell what the patient's losing, so to speak. So, why don't we want to lose lean body mass? Well, it seems simple, but actually, if you look at studies, they have proven that muscle mass correlates to long-term survival. And so if I'm trying to get into the survival game, keeping people younger, longer, living 10, 20 years, we have to preach to them. We want to maintain our lean body mass while we lose our fat mass. We want to flip the scale, so to speak. And not only have we proven using the analyzer that we can maintain lean body mass, but we've actually proven that we can increase lean body mass or muscle mass based on using the analyzer in our practice. Now, let me tell you how we use it. Okay, give you the playbook, so to speak. Let's take a medical weight loss patient that's coming into the office for the first time. They immediately get a free body comp. Okay, and that body comp is part of our initial consult. So we'll do our consult, and then at the end, I'll sit there and say, okay, this is you. Look at this. We have a fat mass that's this. Okay, we're breaking down your body mass index into fat mass index and lean body mass index, and it looks like 48% of you is fat. Normal's between, for a lady, 20 to 36 or whatever it is, and for a guy, it's that. So we need to get that fat mass decreased, right? But we don't want to do that at the expense of your lean body mass. This is your muscle. Okay, you lose muscle, you lose function, and you lose longevity. Okay, so we don't want to lose that. And I'm going to teach you how to maintain that lean body mass while you're on one of these GLP-1s or GLP-GIPs. And so we have that discussion. The nice discussion too that they get very concerned about, or a very important part, is the visceral fat mass. And as we all know, visceral fat is associated with all the baddies, okay, because of the inflammatory component that it provides the body, to include cardiovascular disease, strokes, heart attacks, increased rates of cancer, poor prognosis when you do have cancer, neurodegenerative disease, all the big killers. Okay, so we know that visceral fat is worse than subcutaneous fat. Well, the analyzer breaks that down for you as well, so you can tell exactly how many liters of visceral fat you have. And when I tell people, hey, look at this, yeah, your subcutaneous, your fat mass index is maybe 5 or 8% over, but you park it all in your belly, buddy. And guess what? You have 6.1 liters and normal is 2.2 liters. So you're at very high risk of potentially developing these problems. And if you don't think they're happening right now, they've done autopsies on 18-year-olds after car accidents and found the precursors, fatty streaks, to coronary atherosclerosis in their vessels. It's occurring right now. So if you want to be around and reduce your risk, we need to address that. And now we can use that as a statistical point that we can continue to study as they go through. So in our program, and stop me because I'll ramble forever.
No, I like it. You're saying a lot of things that I do. So I feel like I need to commission you to do some of our education for new providers. It's important. I like the way you're saying it.
Thank you. Thank you. So in our program, we see our patients monthly during dose escalation of GLP-1s. However, we don't mandate that they get a body comp analysis every single month. I think that's kind of like watching the grass grow. But every other month, we do mandate that they get it. And it costs them $25. And now that they know their visceral fat and their muscle mass, and that those are two things that they want to address on top of their weight, they're not just looking at their weight. And remember, and I tell them, I'm not a weight loss doctor. I'm a fat loss doctor. I want to lose your visceral fat. I want to lose your subcutaneous fat and maintain your muscle mass. And again, we need to change that whole discussion in our 100%. Whole field. It needs to be, weight loss needs to go away. We need to talk about adiposity. So anyhow, not to preach on that. So every other visit, so the first visit, they get a free body comp. And now they see the value of it. And they're like, wow, ooh, that's really cool. I didn't know that, this and that. Ooh, I'm really motivated to lose that visceral fat. And they get very motivated. And they're also very motivated to maintain that lean body mass. So the second visit, a month later, we go up in dose. And if we go up in dose, or go down in dose, they see us a month later. Anytime we change dosing to see how they've tolerated. Smart. So on their third visit, they get a body comp. On their fourth visit, and remember, most of these have these medications have 5 or 6 different doses. So on the fourth visit, no body comp. On their fifth visit, they get a body comp. Now, let's say they're at their point where they're kind of at maintenance. Okay, they say, yeah, this fifth visit looks good. We're going to stay on 10 milligrams of Zepbound or whatever it is. And we're going to stay on that. So if they're going to stay on the dose and we're sure it's not going to change, we'll see them in 3 months. And in 3 months, we'll repeat a body comp. Okay. And then at the 3 months after that, we'll let that go. And 3 months after that, we'll get a body comp. And every single time they'll come in, they'll pay the $25, no problems. I have patients that come in and get their own body comps because, as you know, they can get the information by downloading or registering for your site, and then they can look at it too. The other thing that's really cool are the trends. This is my body comp, and this is, oh, look at that. We've got up arrows here, right? So this is a bad thing. So we're going to look at the trends. So I've been doing body comps on myself since last year, February 20th, 2024, when we first got it, right? And as I said, I've been on the medicine. So now you're looking at your body mass index broke down to fat and fat-free mass index, right? But interestingly enough, here's the thing. You look at your fat mass percentage has gone up a little bit. I have no idea. I must be eating too well. But what you can do is you can, in visceral adipose tissue, stayed about the same. Here was me back here, 69.4 pounds of fat down to 60.8 pounds of fat. And then my muscle mass has actually gone up on medicine. So what I've proven is that you can, in 76 to 81, so I've gained 5 pounds of muscle on medicine. So I was able
Wow.
to prove that on weight loss medicines, and I'm going to stop sharing this now somehow. Um, So what you can prove is that, or what I have proved is that you can gain muscle mass on the medicine. Okay. And then what we figured out was, how do you gain muscle mass on the medicine too? Is it exercise? Is it protein intake? Is it creatine? Well, what is it? And it was all protein intake. That's it. So we found that if a patient's got somewhere between 70 to 90 grams in 30-gram doses, okay, 90 grams is perfect, but it's tough to get on those medicines, that patients will lose less muscle mass. In fact, I saw patients today who lost 22 pounds of fat to 1 pound of muscle,
That's
22 to
good.
1, which,
That's really good.
it is because
Yeah.
you'll see that. And I've actually done these on my bariatric surgical patients too. And I had a lady come in the other day, and get this, she was a Sadie. She had lost 65 pounds. Guess how many pounds of fat she lost in those 65 pounds? That was like, 4 to 6 months after.
She's a high protein intake.
She's very good about her protein, and she's 64 though. She's postmenopausal. She's not on hormone replacement, and I didn't. She didn't strike me as a workout warrior. So, but so she lost a total of 64 pounds, and that's what the scale says, right? So, how many pounds of fat did she lose? Or
I'm
60?
going to say 55 since it's a notable story to tell me.
Well, this is how notable this is. She has gotten body comps this whole time, and I can show you the data. She lost 70 pounds of fat. It's a trick question. She actually gained
Wow.
5 pounds of muscle in the immediate post-op period with
Wow.
6 to 8 months. And you
And a
know what?
Sadie.
And a Sadie with
Wow.
protein intake. So what's great is, whether you're doing surgery or medicine, you can use both to kind of monitor your patients, coach them up, and you can also start drawing inferences and conclusions about your therapies to see if they're being effective in maintaining that lean body mass. One last thing that I added was creatine. So that's one thing that we've been using just recently, and we're seeing a nice response to that so far, but the data's still early. But that should be very interesting, because that, as well, is supposedly will increase not only muscle mass, but also increase ATP availability at the cellular level, not just for muscle, but also for brain. And what are we talking about? We're talking about wellness. So, and personally, I've been on creatine, I don't know, about a month and a half, and I've noticed improved performance at my workouts. Usually my
Oh, nice.
workout are 60 minutes with the trainer. He kicks my ass. And at about 4 minute 35 to 45, I'm like looking at the clock, wishing I could tap out, but I don't. Now with the creatine, I kind of get right through the end, and at the end of the day, still have some energy. So it's good. But anyhow,
Yeah, one of the things I really like too, it sounds like you kind of go on a journey with the patient, right? It sounds like you kind of sit there, you look at the numbers, you talk to them about their individual story and sort of explore kind of an experiment, like, we're going to try this and then we're going to bring you back and see where you're at and pivot and tweak if we need to, which I really love that approach.
yes, yes, yes. And I will tell you this: the patients are strongly motivated when they come in. They want to know what their muscle mass is. They want to know what their visceral fat is, especially if they've had high visceral fat. They get extremely motivated. I couldn't do that with a simple scale. If I put them on a simple scale, they'd be looking at a number called their weight, and that's it. Another thing that is helpful, which was helpful in that lady, is, she came in and said, I only lost 65 pounds. When you turn around and say, well, you lost 70 pounds of fat, you gained 5 pounds of muscle, that number now means something different. And you can't
Completely.
tell that without a good body comp analyzer. So, yeah, it's just been a huge hit for the practice.
We've got some new things coming, so I won't give it all away on here, but some trending features that I think are going to be pretty exciting to see. And so a case just like that is what breaks the math and makes it really hard to make the visuals match your trending, but I think we've got we've got it covered, because that's just, I mean, that's beautiful math to see, right?
It blew me away. It blew me away, and the the fun part was I've asked multiple staffers, out of the 65 pounds she lost, how much was fat, and it's a trick question. So
I like that.
yeah.
But yeah, so it sounds like you've got kind of a good system going. It sounds like the patients are really involved. I think another big part of your practice that I'm, jealous of compared to, the flow where in the academic center I was in, it really sounds like the staff is all on board and you're really able to get them to be part of the journey and the fun. And that was always hard in the center that I was at, because we had a lot of turnover. And I think with body comp especially, it's not just you on the back end explaining the results. There's a lot on the front end. So, patients who've been weighed on a traditional scale their whole life see it. At first, it kind of looks like a scale, right? So there's a lot of pre-weighing or pre-measuring that might be a little bit fearful or anxiety to them. And so I think even having everybody on the team from that very first person buy into the whole concept is going to be, huge.
Well, that's a really good point. And in academia, I'm not sure how it's done. As you know, I'm not in academia. I think it may be a little bit more difficult if you don't have 100% buy-in from all your folks, and maybe you do. I mean, in some centers, you may have that, but in my practice, it's pretty straightforward. Everybody gets cross-trained on everything, whether you're on the front desk or the back desk or something like that. So my front desk person can walk a patient back and do a body comp analysis. It's not necessarily medical assist or this or that. So everybody knows how to do one of these body comp analyses, and everyone's had one. And by the way, being around a wellness clinic, it's very interesting. We'll hire a person who's overweight and maybe has some health issues, maybe some body, image issues or something like that. Nothing that we really know. But what happens is by being around us and realizing that some of us have had weight loss surgery, some of us are on weight loss medicine, some of us are on bioidentical hormones. They start exploring that and they start getting into that wellness groove. And they're doing body comps on themselves and checking it out and doing them as well. So they understand the value to themselves. So we no longer have to tell them how to do it. Another thing from a business standpoint, okay, I need to basically make a payroll every 2 weeks, and I've got 10 employees, and I think I pay them pretty well because they're buying new cars. And one of my youngest employee just got a new pair of Nike Airs, which cost more than my shoes. And I told him, hey, man, if you can afford those shoes, you don't need a raise. Okay, you're doing well. I'm taking care of you. But I do want to take care of my employees, give them the best insurance I can so their health care is taken care of. I do want them to feel well because I want them to be focused when they come to work and not necessarily worry about that part, best as I can. So I tell them, hey, I'm going to Jerry Maguire you. Help me help you. You know that magic money that shows up in your account every 2 weeks? Okay. It's got to come from somewhere. So I don't want you selling anything that a patient doesn't need, but help support our cause, help contribute to our cause. So the body comps are part of that contribution in a way, though, now that we have a more rigorous way about it, they're not really necessarily involved in doing it. I can tell you that that young guy I was talking about, uh, I was in the office yesterday with my wife for 10 hours working on our new liposuction suite. And talk about a romantic way to spend a Sunday. Anyway, that young guy was in there with a friend of his. And, on weekends, I let them come in if they want to do a treatment or something like that on them, as long as there's no cost to it, there's no cost to the patient, and they can do it, their friends and family. And so guess what he was doing? He was doing a body composition analysis on one of his friends, at 20. Yeah. So, and this is a 23-year-old guy. So he gets it. So body composition analysis is central to weight loss. And uh, again, fat loss. And I really think if you're not using something like this or very similar, very high quality to it, um, that you're not doing everything you can for the patient. Uh, and again, if you charge $25, patients, they pay for that. No problem. They don't, that's fine with them. They see the value in it as long as you sit down and explain it to them. You don't spend a whole lot of time. It can be 3 to 5 minutes in brushing over the important points. As long as you explain it to them, then I do think they feel the value in it.
So I knew you first as a bariatric surgeon. And so, I've been in that field for almost 20 years now. One of the things I think about all the time is why body comp has not been in 100% of the practices back then, why it almost took medication as an option to get that over the, kind of standard of practice type of a hump, which is where I think we're kind of getting close to. Do you have thoughts about that?
Well, yeah, I do, and you might like the answer, and you might not. I think it's great for a surgical practice to have it. The problem that you have is that surgical patients don't always follow up. I have a beautiful office, and I do everything I can to get my patients. I take every insurance that they have no-cade. I told them I'll see you for free. Just get seen, get your labs done once a year, and make sure you're taking your vitamins. I've comped people vitamins and calcium out of the office, or I give them at cost. But you still can't get 100% follow-up. We know long-term follow-up is probably less than 50, 40, 30%. If I'm looking at my schedule the next day and I see 3 bariatric follow-ups that are more than 12 months old, I can coin flip that and say that 50% of them will probably not show up. And it's unfortunate. I don't know why. Because I feel like I do everything I can to create a friendly, welcoming, supportive atmosphere. And
Yeah, it sounds like it.
medical weight loss patients have to come back. Okay. They have to come back because they need their medicine. And their follow up is about 98%. Okay. So, from that standpoint, so it's tough to
Hmm.
use that data if the patients aren't necessarily going to come back. You can use it on the ones that do. I mean, I think it can be very useful, but it's very hard and it's frustrating to me because it's hard to, determine long term kind of what can I say, long term, make long term decisions because you can't get adequate data because you can't get adequate follow up. Whereas the medical weight loss patients, I was able to get adequate data very, very quickly. And then what I did was, even though it's not scientific, transpose that data over onto the surgical folks, which I think what we've been saying the whole time, and you know as well as I, protein, protein, protein. Get your protein, keep your carbs low, don't eat sugar, et cetera, et cetera. Take your vitamins, protein, protein, protein. That is the key. The key. Exercise is great, and I tell people, yeah, listen, I love exercise. Get people to exercise. I have a class every week where I work out with my patients every Saturday.
I see you on social, always on the Saturday. I love that.
8:30 in the morning. Yeah, patients don't love it. 8:30 in the morning on Saturday, Dr. Bruce, I'm sleeping. I'm like, well, if you come to my office and you're whining about, I didn't lose that much weight. Well, yeah, I didn't see you any Saturday in the past month either. So help me help you, right? But the point is getting people to exercise is not as easy as you think. We encourage it, we push it, we do everything we can. But even with maintenance of protein intake, you can do a pretty good job of staving off unwanted lean body mass loss. But you cannot calculate it without having a proper tool to calculate it with. And that's where the body comp analyzer comes in.
I love that. Yeah, it's just a different type of a model with surgery versus medication. But what I love nowadays too is that it's really not surgery versus medication. I'm seeing so many more kind of comprehensive programs. You're our patient, we'll take care of you, whatever your needs are. I'm seeing a lot more of that than we had in the past, which I think is really good for the patient. So I love
Oh,
love
yeah.
seeing that you're doing that in all those ways too.
Yeah, I'll tell you what. If you're like me and you've seen other your patients love you. You've played such an important role in their life when they've had weight loss surgery that they trust you. They come to you when they have something wrong or they need a referral or whatnot. So it's very nice. And like you said, now it's not just surgery or medicine. Sometimes it's surgery and medicine, or sometimes it's medicine and surgery. I mean, we're seeing people get knocked off all the time off these. They have the medication for 12 months, and then their payer stops paying for it, and next thing
Mm,
you know, they're going to surgery. So, it can be a little bit of both. So,
yeah. Well, I love hearing what you're doing. It's been a busy year for you. It sounds like body comp has really been a nice piece of the year, and can't wait to hear what you do next. Definitely need to come back and visit and see the images. A lot of the images that we have and some of our video material are right there in your office. So I feel like I've been there a lot.
yeah, well, as I said, you guys have a spot right on our website. That's how important it is to us. We actually have a web page just for the body comp analyzer because, as a practice, it's a differentiator. It tells them that we're really watching what's happening to them and taking care of them, as opposed to just handing out a medicine or doing a surgery.
Well said. So how do we find you? How do we stay in touch or model our practice after what you're doing?
Listen, if anybody watches this, yeah, and they're not completely turned off by me, feel free to just give me a text, 919-538-2600. Don't email me. 30 emails, one of them is useful. 29 of them don't. Don't hit me up on LinkedIn because I get so many people selling me so many things on LinkedIn. Just give me a text if you ever want to learn more about this. I'll text you right back. Usually, I love really truly linking up with people and helping people any way I can. And many times I learn as much or more from other people. Thankfully, still even at this old age, than I think they do from me. So just reach out.
Awesome. Well, very generous of you. I'm gonna have it flashing up like the like the infomercials.
Don't 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 do that. Don't call 999.
Well, thank you so much, Dr. Bruce. It was great to see you, and hopefully we'll reconnect soon. And thanks for your time today.
Nina, thank you so much. Great times.
Bye bye.